Hi there, I'm Coach Darwin, and in this video, I want to speak specifically to anyone out there who's having a total joint replacement, so a total knee or total hip replacement. Now, I'm speaking directly to those of you who are in your midlife, so I'm saying upper 40s, 50s, and 60s. The average person who gets a joint replacement is 65 or 66, so you're obviously on the younger side of it. Now, what I hope you're doing is you're going into this surgery is you're looking at this not as a setback, but really as kind of a midlife comeback. Hopefully after the surgery, you expect to have a whole new chapter in your life where you're getting back to doing a lot of activities that you haven't been able to do in the past because of the pain or limited mobility in your knee or hip. So what I want to go over today is just a simple way that you can start to get your muscles firing again in order to prepare you for surgery and then a quick recovery. We're going to need the body, all the muscles and the joints to be really active and really strong going into surgery. And that way you can improve the chances of having a successful surgery and actually a much faster recovery. So what we need to do as you go into, we call it prehab or prehabilitation, what you need to do is go into the surgery as strong, as flexible as possible. And strengthening all the muscles around your hip and your knee is really important. Getting the flexibility there is really important. But what I want to show you today is one specific technique to really just get the quadricep muscle firing. Now, this is really important because it helps support the knee itself. And you'll notice once you have your surgery, there'll be a lot of pain and swelling in the knee and or the hip. And what the body tends to do is just shut off muscles from firing. So we need to create this neurological loop to teach the muscles how to fire, even if there's swelling and pain involved. Now, we're going to make this specifically for kind of the younger subset who's having surgery. And we're going to show this in 3 different phases because, again, you guys are going to be more advanced. Your rehab should be a little bit more advanced to get you back to doing the activities you want to do. So let's start out with the first version of this exercise. Okay, so the first exercise in this quad set progression, you're going to need just a small rolled up hand towel and a ball. This happens to be a very flat volleyball, flattened by a cactus, but don't ask. It doesn't have to be flat. It can be a basketball or a football, something that's got a little bit of circumference to it. So starting with the hand towel, we're going to be sitting down this way, and you're just going to put the hand towel behind the knee. So from here, with the leg straight and probably your other knee bent up is going to be a little more comfortable for your back. But from this position, you're just going to press down onto the towel roll. So what we're doing is just firing this quadriceps muscle. You should see the muscles kind of fire and bulge, and you're going to hold that for 5 seconds and then relax. So just pressing down, holding that contraction, really trying to get a sense of what it feels like for that muscle to contract, and then relax. If you're having a difficult time firing that muscle, sometimes it helps to physically just take 2 fingers and just tap on that muscle and then contract. And what it's doing is just kind of neurologically waking it up, in a sense, this tapping. Okay, so in this position, you actually have gravity to help pull it down, and that's why we start in this position. Now, for some of you, that might be painful with your leg or knee straight like this. So that's why we have a ball or a bigger object to place under the knee. And from this position, it might be a little less painful. So what you need to do is just play with the angle of the knee. And quite frankly, it's probably best if you can fire that quadricep in multiple angles. So from here again, now the heel is going to stay down and you're going to press down again into the ball. One option is you can extend the heel up off the ground if you want. That's kind of, now we're contracting and moving through that motion. That's fine too. But for the sake of this video, we're just contracting that muscle, holding it for 5 seconds, and it should definitely be pain-free. You should not feel any pain as you're doing this. So once you've mastered that and you're feeling like this muscle is really contracting, we'll take it to the next level. Okay, moving on to the second phase of this exercise. You've already got your quads firing. You feel pretty comfortable with contracting that muscle. Now, it's important to make sure that you can contract that muscle in a standing position, because if you're going to go back to running or biking or playing golf or skiing, you're going to need that muscle to contract while you're standing and moving. So what we're going to do is you can take this same volleyball that you may have used in the first exercise. Now you're going to stand up and put the ball again right behind the knees you did with the first exercise. From here, you're going to stand up nice and tall, and it's exact same motion or contraction as the first exercise. You're just tightening the muscle and squishing the volleyball in this position. Hold it for about 5 seconds and then relax and then press straight back. You should feel that muscle firing. And again, like the first exercise, if you're having pain with this, you should change up the knee angle. So use a towel roll or use a bigger ball or something like that to where you can contract the muscle without it causing pain. Again, 5-second holds, and you want to try to manage your weight. Start out with, if you can, at about 50% weight bearing on your right and left foot, or you're involved and uninvolved. And if you can, if it's not too painful or not too difficult, you can start to try to lean onto the involved side even more than 50% and then contract through that. Right? That is the second phase. And I'm going to show you just one more additional step to make this even more challenging. Okay, the last progression in the quad set exercise, you're going to need a resistance band, a looped resistance band like this one. This one is really thin. It doesn't offer a lot of resistance, and that's okay. And the next thing you're going to need is a stable surface that's heavy enough that you can loop the band around. So what we're going to do is just go ahead and loop the band and secure it to our stable object. From here, we're going to step back and step into the looped part, putting the band around the back part of the knee. And from here, again, just like you were doing at the wall, you're just pressing back against that resistance of the band and then releasing. So pressing back and releasing. Again, as with the wall, you want to try to start with about a 50% weight bearing on both legs. And as you start to feel more comfortable, you're going to shift your weight over onto that involved leg as you're contracting. Now, this is going to be a little bit different than sitting and on the wall where you're holding that contraction. In this exercise, I want you to actually contract, relax, contract, relax. And what that's doing is getting this muscle ready for activity like walking and running and moving. So getting it contracting through motion. All right, I hope those 3 exercises are helpful for you. I hope you're going to have a very successful surgery and a lightning fast recovery when you're getting the quads firing like this. I wish you all best of success and best of health.